Decompression strategy for critical size lesion, a case series and literature review. This paper was published in Australian Endodontic Journal in 2021 by a Pakistani group led by Umer. So decompression is a surgical technique that creates communication between cyst contents and oral cavity, and it is usually used interchangeably with marsupialization. In the literature regarding this technique, there is no clear protocol or guidelines to when perform such procedures. However, what we can mention is that whenever you suspect a cystic lesion that is over 25 millimeter and it is in a proximity of a vital structures, or the removal of such lesions would require a lot of sacrification of other structures, then such technique should be considered. For the technique, incision will be made through the fenestration and then the tube will be inserted. However, sometimes there will be no fenestration and this will be assisted through a CBCT where you will have intact critical blade. In this case, you have to create some window by removing off bone and then insert the tube. For the type of tubes that should be inserted, we could utilize the nasogastric or endotracheal or IV tubes in those scenarios, and then these need to be maintained on daily basis with irrigation with either saline or chlorhexidine. In regard for the termination of decompression procedures, again, there is no clear protocol for the termination and the follow-up period vary extensively in the literature. However, what they have mentioned is that whenever you have signs of trabeculation or shrinkage of the lesion radiographically, and also the shrinkage of the lesion could be confirmed clinically by having to adjust the tube and making it shorter every now and then. Two comments I have for this topic. The first one is in this literature review and also in another one that was published in JOE 2018 by Franklin Tay Group, and it resembles the design of this study. Both literature review mentions that secondary inculation is not required for most cases. However, for me, I think this surgical procedure is used to facilitate the second surgery. The second comment is we know that this technique should be utilized for large cystic lesion. However, cyst is a histological terminology and it cannot be confirmed radiographically, neither clinically. And the only way to confirm it is through a histological analysis. So they suggested to utilize some cytology through aspiration or doing some albumin test. However, all of these just to increase the probability of you having cystic lesion other than other type of lesions. And in the findings of the aspiration, they mentioned epithelial cells that will be degenerated. However, we know that also granulomatous lesions can also have some epithelial cells inside them or epithelial strands, and this has been demonstrated by Simon in 1980. So even with this, you cannot really confirm this is an epithelial lining or not.